everyone. So together with my groupmates, we are going to talk about HIV/AIDS. And also, we are going to talk about the latest drugs that are used to treat this disease. So without further ado, let us proceed to the presentation or the video itself.
And I'm going to discuss about the overview of it and the pathophysiology. So today we will discuss about the overview and pathophysiology of HIV and AIDS. So first, what is HIV? HIV is a virus that targets and alters the immune system, increasing the risk and impact of other infections and diseases. Without treatment, the infection might progress to an advanced disease stage called AIDS. HIV stands for Human Immunodeficiency Virus. Human because it infects human being. Immunodeficiency since it decreases or weakness in the body's ability to fight off infections and illnesses. Virus since it is a pathogen having the ability to replicate only inside the living cells. So there are two types of HIV virus. The first one will be the HIV-1, which is the most common in sub-Saharan Africa and throughout the world. HIV-1 is divided into four groups, which are the group M, N, O, and P. The pandemic is dominated by group M, which is composed of subtypes A to J. The next one will be the HIV-2, which is most often found in West Central Africa, parts of Europe and India. Both produce the same patterns of illness, however, HIV-2 causes a slower progression of disease than HIV-1. Next will be the structure of HIV. So like all viruses, HIV is made up of two main elements, the external envelope and the internal core. HIV is in a family of viruses called retrovirus. So the first structure will be the envelope, the next one will be the core P24, the next one will be the reverse transcriptase, and lastly will be the RNA. So what is AIDS? AIDS is the final stage of disease caused by infection with the virus. AIDS stands for Acquired Immune Deficiency Syndrome. Acquired, which is to come into possession of something new. Immune deficiency, since it decreases or weakness in the body's ability to fight off infections and illnesses. Syndrome is a group of signs and symptoms that occur together and characterize a particular abnormality. So what are the differences between the HIV and AIDS? HIV is a human immunodeficiency virus and AIDS is acquired immune deficiency syndrome. HIV is a virus that invades the immune system, while AIDS is the last stage of a spectrum of conditions initially caused by the HIV infections. HIV patients will suffer minor difficulties and the symptoms will be similar to flu. AIDS patient will experience severe signs and symptoms disrupting the quality of life. So how HIV is transmitted? First is through unprotected sexual contact with an infected partner. Second will be the transfusion with HIV-infected blood. Third will be the injection with contaminated objects. And lastly will be the mother-to-child during pregnancy, birth, or breastfeeding. Lastly will be the pathophysiology of HIV life cycle. HIV is a single-stranded positive sense envelope retrovirus. Each variant is made up of lipid bilayer with a capsid inside it containing 2 copies of an RNA genome, as well as reverse transcriptase, protease, and integrase. The viral envelope is derived from the lipid bilayer of a host cell and has glycoproteins sticking out of it necessary for the virus to infect cells. These glycoproteins, GP120 and GP41, together form GP160, a trimer with 3 pairs of GP120 and GP41 glycoproteins forms an envelope spike complex. The capsid is a protein shell that protects genome. Reverse transcriptase, integrase, and protease get to work once HIV is inside a host cell. First, let's follow HIV's life cycle. Infection most commonly results from the sexual contact, though it is also possible to contact HIV from contaminated needles or rare cases from blood products such as blood transfusions. It is also possible for babies to get HIV from their mothers while in utero or from breastfeeding. Fortunately, you can't get HIV from casual contact, air, water, or mosquitoes. How does HIV enters cells? GP120 binds the CD4 glycoproteins. This triggers a conformational change that exposes binding sites for a co-receptor, either CCR5 or CXCR4. CCR5 is found on T cells, macrophages, monocytes, and dendritic cells, while CXCR4 is found exclusively on T cells. Anyway, further conformational changes reveal the fusion peptides of GP41. These fusion peptides are inserted into the host cell membranes, and HIV's viral envelope can now fuse to it. The presence of both the CD4 glycoprotein and its co-receptor are essential for HIV to enter a host cell. Since almost all HIV-1 isolates are successfully transmitted using the CCR5 co-receptor, people with homozygous mutations in their CCR5 are basically immune to HIV. Even heterozygous mutations can slow the infection's progression. HIV single-stranded RNA gets reverse transcribed by reverse transcriptase into double-stranded piece of DNA. As the reverse transcriptase goes about this process, the capsid uncoats. The double-stranded piece of DNA associates with integrase and is brought into the nucleus. Their integrase integrates the HIV DNA into the cell's genome. The DNA is termed proviral DNA, and viral RNA get transcribed from it. Many other retroviruses wait until mitosis when the nuclear membrane is broken down to integrate their genome, but HIV interacts with proteins of the nuclear pore and gets admitted. Once HIV's proviral DNA is integrated into the host cell's genome, it cannot be eliminated except by killing the host cell. The viral DNA is transcribed and translated into viral polyproteins, which move to the surface of the cell and form an immature HIV. This HIV pushes itself out of the cell, grabbing part of the cell's membrane to form the viral envelope. Protease comes in and cleaves the polyproteins at 9 cleavage sites to create mature protein components. And we have a new HIV variant.
Hi, I'm Paolo Barcina and I'll be discussing history of HIV/AIDS. According to medicalnewstoday.com, doctors are not exactly sure when HIV originated, but they believed it developed from a type of chimpanzee virus in West Africa called simian immunodeficiency virus, or SIV. Scientists later discovered that hunters hunt and eat two smaller species of monkeys, red-capped mangabeys and greater spot-nosed monkeys, that carry and infect the chimps with two strains of SIV. These two strains likely combine to form SIV-CPZ, which can spread between chimpanzees and humans. Those people who hunted chimpanzees for meat came in contact with infected blood and contracted the virus. Researchers believe the first transmission of SIV to HIV in humans that then led to the global pandemic occurred in 1920 in Kinshasa, the capital and largest city in the Democratic Republic of Congo. Genetic analysis later determined that the virus might have developed between 1910 and 1930. The virus may have spread from Kinshasa along infrastructure routes, roads, railways, and rivers, via migrants and the sex trade. In the 1960s, HIV spread from Africa to Haiti and the Caribbean when Haitian professionals in the colonial Democratic Republic of Congo returned home. The virus then moved from the Caribbean to New York City around 1970 and then to San Francisco. International travel from the United States had made a huge impact in terms of helping the virus spread across the rest of the globe. In the mid and late 1970s, doctors had noticed that people in New York and California were developing rarer forms of opportunistic infections, such as aggressive pneumonia and rare cancers. Opportunistic infections tend to occur in people who have suppressed immune system. In healthy people, the immune response is enough to keep these infections at bay. Doctors at this time did not know that a virus was the cause of these infections. Studies have shown that HIV was present in North America, South America, Europe, Asia, and Australia before 1980. There are misunderstandings about the virus and its transmission that became a problem in the early years of HIV in the United States because in 1981, doctors and researchers began to notice a set of symptoms in previously healthy young men who had sex with men. At first, Healthcare providers call the disease gay-related immune deficiency, but doctors also began to observe that intravenous drug users also experienced the same symptoms. In 1982, doctors realized that the symptoms and related conditions were due to a suppressed immune system. When the doctors knew that the related conditions were due to a suppressed immune system, they began to call it acquired immunodeficiency syndrome, or AIDS. Scientists believe that those who had conditions such as Kaposi's sarcoma, a rare form of cancer, or a form of pneumonia called pneumocystis Irovetsi, had acquired them through AIDS. In 1983, the scientific community identified the virus that causes AIDS. They first named the virus human T-cell lymphotrophic virus type 3 or lymphadenopathy associated virus. But later, researchers changed the name to human immunodeficiency virus. They also identified the leading methods of HIV transmission and learned that a person could not contract HIV from casual contact, food, water, or air. By 1989, around 100,000 people in the United States reportedly had AIDS, which develops from untreated HIV. According to the Canadian Foundation for AIDS Research, an estimated 8 to 10 million people across the world were living with HIV by 1990. And in 1991, the red ribbon became the symbol of AIDS awareness. In 1996, around 23 million people around the world are living with HIV and AIDS, according to the Canadian Foundation for AIDS Research. By 1999, AIDS-related illnesses were the fourth leading cause of death worldwide, and it is the number one cause of death in Africa. At this time, 14 million people had died from AIDS-related illnesses since the HIV epidemic began. This year, according to UNAIDS.org, 37.9 million people globally are living with HIV. 1.7 million people became newly infected with HIV, and 74.9 million people have become infected with HIV since the start of epidemic.
Hello, I'm Nicolas Salgado, and I will be discussing the worldwide and national statistics of HIV.
Let's talk about the worldwide and nationwide statistics of HIV. On the worldwide statistics, stated on the World Health Organization website in 2018, there is an estimated 37.9 million people globally who live with HIV. There is also about 62% of people living with HIV who are receiving antiretroviral treatment in 2018, which accounts for 23.3 million people. Africa has the most number of HIV cases, followed by Southeast Asia, Americas, Europe, Western Pacific, and lastly, Eastern Mediterranean. On the global response to HIV, Africa leads on the number of people who are receiving antiretroviral treatment. Next is Americas, Southeast Asia, Europe, Western Pacific, and lastly, Eastern Mediterranean. On the national statistics, a report from UNAIDS states that in 2018, there's about 77,000 people living with HIV in all ages. On the global HIV epidemic states that the number of new cases of HIV has more than doubled in the past 6 years, from an estimated 4,300 in 2010 to an estimated 11,000 in 2016. In Asia, the Philippines is the country with the fastest growing number of HIV cases and is one of 8 countries that account for more than 85% of new HIV infections in the region. Majority of new infections are occurring at an age group of 15 to 24 years old. In 2015, only 35% of 15 to 24 years old male who have sex with males and transgender women had the appropriate knowledge on HIV transmission and prevention, which is indicative of the need to step up HIV information efforts in eliciting behavioral change among people who are at risk. The percentage of male who have sex with males and transgender women who are getting tested increased from 15% in 2011 to 16% in 2015. However, it is still considerably low.
I am Veronica Crisnido and I am going to discuss The causative agent for HIV is the human immunodeficiency virus, which can also lead to acquired immunodeficiency syndrome or AIDS. There are two major types of HIV virus, HIV-1 and HIV-2. HIV-1 virus is most common and infectious. There are 4 strains of the HIV-1 virus, Group M, Group N, Group O, and Group P. The HIV-1 Group M strain is responsible for the worldwide HIV epidemic. Within the Group M, there are 9 genetically distinct subtypes of HIV. These are subtypes A, B, C, D, F, G, H, J, and K. These subtypes can combine genetic material to form a hybrid virus known as circulating recombinant form or CRF, and around 89 of these are existing. Nearly 50% of HIV cases have the subtype C virus. On the other hand, HIV-2 is mostly seen only in West Africa or the other countries related. It is less infectious and slowly progresses but can still cause AIDS and death if not treated. HIV can be transmitted through different modes, which are number 1, sexual contact like oral, vaginal, and anal sex. Donated semen and artificial insemination can also transmit HIV. Number 2, direct blood contact. Intravenous drug use with shared needles or shared drug works, shared personal contaminated items, blood transfusions, or organ transplant. Number 3, mother-to-child contact like maternal fetal blood circulation during delivery or breast milk. Those at high risk also include persons who engage in unprotected sex, those with multiple sexual partners, IV drug users who share needles, and infants born to women with HIV.
Hi, I'm Julieta Trinidad and I'm going to talk about signs and symptoms of HIV. Signs and symptoms of HIV. The symptoms of HIV and AIDS vary depending on the phase of infection. People who are infected by HIV develop a flu-like illness within a month or 2 after the virus enters the body. Possible signs and symptoms include fever, headache, muscle ache and joint pain, rash, sore throat and painful mouth sores, swollen lymph glands mainly on neck. These symptoms can be mild that you might not even notice them. However, the amount of virus that enters your body, especially to your bloodstream, is quite high at this time. As a result, the infection spread more easily during the primary infection during the next stage. The next stage is the clinical latent infection or the chronic HIV. In this stage, the virus still multiplies, but at a very low level. Some people, persistent swelling of lymph nodes occurs during this stage. Otherwise, people in this stage may not feel sick or have any symptoms. The third stage is the AIDS. If you don't have received any HIV treatment, eventually the virus that enters your body will weaken your body immune system and it will progress to AIDS or the acquired immunodeficiency syndrome. The signs and symptoms of some of this infection may include soaking night sweats or recurring fever, rapid weight loss, chronic diarrhea, sores of the mouth, skin rashes, and swelling of lymph nodes. Hello, good morning everyone. So I'm Zia Gomez and I'm going to discuss about the treatment and specifically I'm going to talk about NRTIs or nucleoside reverse transcriptase inhibitors and also non-nucleoside reverse transcriptase inhibitors or NNRTIs. And also, I'm going to talk about some drug combinations for the treatment of HIV/AIDS.
The U.S. Department of Health and Human Services expert panel on antiretroviral guidelines for adults and adolescents, or the panel, stated that 2 NRTIs plus 1 active antiretroviral drug plus PK enhancer is the ideal drug combination for antiretroviral therapy. Nucleoside reverse transcriptase inhibitors, or NRTI, is also known as the first antiretroviral drug. NRTI prevents reverse transcription of viral DNA.
When NRTI embeds to the reverse transcriptase enzyme of the growing chain of viral DNA, naturally occurring nucleoside, which is a need for the growing chain of viral DNA, will now be terminated. This action is called as chain termination. Since it now prevents another naturally occurring nucleoside to be added to the growing chain, reverse transcription will not be continued. Therefore, viral DNA is not fully formed, and multiplication will not take place. Since we are focused about the latest drugs for HIV/AIDS, I am only going to talk about emtricitabine, which has the brand name of Emtriba, since in NRTI, it is the latest approved drug. Emtricitabine, which has the brand name of Emtriba, was approved by the FDA last July 2, 2003. Its dosage is 200 mg per capsule or 10 milligrams per ml oral solution. Its side effect is skin discoloration and occasional dizziness. Its adverse effect is immune reconstitution, inflammatory syndrome, lactic acidosis, hepatotoxic, and it can worsen HBV. Non-nucleoside reverse transcriptase inhibitors or NNRTIs directly bonds into the active catalytic site of the reverse transcriptase enzyme. Therefore, when this happens, NNRTI stops the function of the said enzyme. Therefore, transcription of the viral DNA will not take place. And there will be no multiplication of viral DNA. So for NNRTIs, I am going to talk about the 4 latest drugs that was approved by the FDA, which are doravirine, extended release, nevirapine, rilpivirine, and etravirine. For doravirine, which has a brand name of Difeltro, it was approved by the FDA August 30, 2018. It is the latest non-nucleoside reverse transcriptase inhibitors or NNRTI. Its dosage and frequency is 100 mg tablet. It is taken once daily. Its side effect is nausea and vomiting, occasional dizziness, headache, tiredness, diarrhea, and abnormal dreams. Its adverse effect is immune reconstitution, inflammatory syndrome. Its nursing considerations is remind the patient to always take it with other HIV meds, and it can be taken with or without meals. Extended release nevirapine, which has a brand name of Viramune, was approved by the FDA last March 25, 2011. Its dosage is 100 mg or 400 mg. Its side effects is occasional dizziness, nausea, and vomiting. Its adverse effect is hepatotoxic, skin rash, and skin reaction. Nursing responsibilities or considerations are the patient should have laboratory monitoring, including liver enzyme test, and it should not be taken with efavirenz, since adverse reaction can occur. Rilpivirine, which has a brand name of Endurant, was approved by the FDA last May 20, 2011. Its dosage and frequency is 25 milligrams per tablet, and it's taken once daily. Its side effect is headache. Adverse effect is skin and hypersensitivity. Hepatotoxic, it is depressive, insomnia, and redistribution or accumulation of body fat. Nursing consideration for this drug or nursing responsibilities are should be remind the patient that it should be taken with meals, and It is also contraindicated to anticonvulsants, antimycobacterials, glucocorticoids, and herbal products, and also proton pump inhibitors. Etraverin, which has a brand name of Intelens, was approved by the FDA last January 18, 2008. Its dosage are 25 milligram per tablet, 100 milligram per tablet, and 200 milligram per tablet. Its side effects is nausea and vomiting, loss of appetite, extreme tiredness, fever, and dizziness. Adverse reactions are peripheral neuropathy, lipodystrophy syndrome, and it can also cause diarrhea in children. Nursing consideration is to remind the patients that it should be taken after meals and also instruct the patient not to chew the tablet. For drug combinations, I am only going to talk about 4 drug combinations, and my other group mates will talk about the other drug combinations that is approved by the FDA. For abacavir, lamivudine, and dolutegavir, it has a brand name of Triumeq, which is composed of 2 NRTIs and 1 integrase inhibitor. It was approved by the FDA last August 22, 2014. Its dosage are 600 mg of abacavir, 50 mg of dolutegavir, and 300 mg of lamivudine. Its side effects is nausea and vomiting, occasional dizziness, trouble sleeping, headache, and tiredness. Adverse effects are lactic acidosis, hypersensitivity reaction, and hepatotoxicity. Nursing consideration is before starting the treatment, ask the patient if he or she has a liver problem or perform liver enzyme test. For atazanavir and copiscat, its brand name is Evotas. It contains a protease inhibitor and a pharmacokinetic enhancer. It was approved by the FDA last January 29, 2015. Its dosage is in 1 tablet. It contains 300 milligrams of atazanavir and 150 milligrams of copiscat. Its side effects are mild rash and jaundice. Adverse reactions are heart rhythm problems, hepatotoxicity, gallbladder problems, and nephrotoxicity. For the nursing considerations, ask the client if he or she has heart, liver, or kidney problem, or perform a liver function test before starting the treatment. For bictegravir, emtricitabine, tenofovir, alafenamide, its brand name is Biktarvy. It is composed of 1 integrase inhibitor and 2 NRTIs. It was approved by the FDA last February 7, 2018. In 1 tablet, it contains 50 milligrams of bictegravir, 200 milligrams of emtricitabine, and 25 milligrams of tenofovir alafenamide. Its side effects are nausea and vomiting, fatigue, and trouble in sleeping. Adverse reactions are lactic acidosis, hepatotoxicity, and nephrotoxicity. Nursing considerations are do not take it with rifampin because it can cause life-threatening effects. It should not also be taken by a pregnant woman since integrase inhibitors is associated with neural tube defects. For darunavir and copiscat, the brand name is Prescobix,
which is composed by one protease inhibitor and one pharmacokinetic enhancer. It was approved by the FDA last January 29, 2015. Each tablet contains 800 milligrams of darunavir and 150 milligrams of Cobiscat. Its side effects are nausea and vomiting and occasional dizziness. Adverse reactions are hepatotoxicity, nephrotoxicity, and severe skin reactions. For the nursing considerations, assess for allergy to sulfonamides, instruct the patient to take it with food, take missed doses as soon as remembered, if within 12 hours.
Hi, I'm Danielle Ko, and I'll be discussing protease inhibitors. Protease is needed by HIV in order to replicate within the body. By blocking the action of these enzymes, we can stop the HIV life cycle and stop it from multiplying within the body. In 2006, the latest drug was discovered called darunavir, and the brand name is Resista.
Darunavir is the generic name. The brand name is Persista. It was approved on June 23, 2006. The dosage and frequency is as followed: 75 mg, 150 mg, 600 mg, and 800 mg tablets. Also, there was an 100 mg/ml oral suspension. It is taken twice daily. Some side effects include diarrhea, headache, abdominal pain, constipation, vomiting, and nausea. Some adverse reactions include skin rash, including Stevens-Johnson syndrome, and erythema multiforme hepatotoxicity. Elevation of hyperglycemia, fat maldistribution, increase in bleeding with people who have hemophilia. Some nursing considerations are it should be taken with food, non-approved for infants and neonates, contraindicated in concurrent use with other drugs for which changes in blood levels are associated with, as well as serious toxicity or loss of effectiveness, as well as lactation. Tiprenavir is the generic name. The brand name is Heptivis. It was approved on June 22, 2005. The frequency and dosage is as followed: 250 mg capsules and 100 mg per ml oral solution taken twice daily. Some side effects include nausea, dizziness, abdominal pain, diarrhea, insomnia, and dyspnea. Some adverse reactions include liver problems, severe rash, bleeding in the brain, hyperglycemia, changes in immune system, increased bleeding in people with hemophilia. Some nursing considerations are it can be taken with or without meals. It's taken the same time as ritonavir, swallowed whole, contraindicated for pregnant women, lactation, hypersensitivity, moderate to severe hepatic impairment. Atazanavir is a generic name. The brand name is Reataz. It was approved on June 20th, 2003. The dosage and frequency is as followed: 100 mg, 150 mg, 200 mg, 300 mg. It is a capsule and is taken once daily. The side effects include fever, nausea, vomiting, stomach aches, diarrhea, headache, muscle pain, dizziness, and insomnia. Some adverse reactions include changes in body shape or location of body fat, numbness or pain in hands and feet, unexplained weight loss, yellowing of eyes or skin, increased bleeding in people with hemophilia. Some nursing considerations include monitor CV status and ECG closely, take after meals, contraindicated for people with hypersensitivity, severe hepatic insufficiency, and for lactation. Fosamprenavir is the generic name. The brand name is Lexiva. It was approved on October 20th, 2003. The frequency and dosage is as followed: 700 mg tablets, a 50 mg per ml oral suspension. It can be taken every 12 hours or taken once daily. Some side effects include diarrhea, nausea, vomiting, headache, and dizziness. Some adverse reactions include rash, liver problems, hyperglycemia, neurotropenia, increased bleeding in people with hemophilia. Some nursing considerations is that it can be taken with or without food, Review contraindications if taken in combination with other drugs. Contraindicated for severe hepatic impairment, pregnancy, allergy to the drug components, and for lactation.
Hi, I'm Danielle Ko, and I will be discussing the following combination drugs used to treat HIV and AIDS. These are the brand names: Simtuza, Dovado, Juluca, and Delstrigo.
Composed of darunavir, cobicistat, emtricitabine, tenofovir, alefenamide. These are the generic names, and the brand name is Simtuza. Two of these are NRTIs, and one is a protease inhibitor. It was approved of on July 17, 2018. Some side effects include nausea, dizziness, changes in body fat, fatigue, headache, abdominal pain, and gas. Some adverse reactions include rash, lactic acidosis, severe liver problems, kidney failure, changes in immune system, hyperglycemia, and increased bleeding for hemophiliacs. Some nursing considerations is that it should be taken with food. The tablet may be split using a cutter if it is too large to swallow. Test for Hep B virus. Assess serum creatine, urine glucose, urine protein, and serum phosphorus with clients with chronic kidney problems, and it is contraindicated for patients with hypersensitivity to any components. Composed of dolutegravir and lamivudine. These are the generic components of a brand name Dovado. The classification of these drugs are NRTI and was approved of on April 8, 2019. Some side effects include nausea, dizziness, headache, diarrhea, insomnia, and fatigue. Some adverse reactions include rashes, immune reconstitution, inflammatory syndrome, liver problems, lactic acidosis. Some nursing considerations are it should be taken with or without food. The tablet may be split using a cutter if it is too large to swallow, and it is contraindicated for lactation in those with hypersensitivity. Composed of dolutegravir and rilpivirine, these are the generic components of a brand name called Juluca. It is an integrase inhibitor as well as an NNRTI. It was approved of on November 21, 2017. Some side effects include nausea, dizziness, diarrhea, and headache. Some adverse reactions include severe rash, liver problems, depression or mood changes, and some nursing considerations is that it should be taken with a meal. Do not take proton pump inhibitors while taking this medicine, and it is contraindicated for patients with hypersensitivity to any components. Composed of doravirine, lamivudine, tenofovir, disoproxil, fumarate. These are the generic components of a brand called Delstrigo. It is composed of an NNRTI and NRTIs. It was approved of on August 30th, 2018. Some side effects include dizziness, nausea, abnormal dreams, diarrhea, and drowsiness. Some adverse reactions are severe rashes. Some nursing considerations is that it can be taken with or without food and contraindicated for patients with hypersensitivity to any components and should not be taken with drugs that are strong cytochromosome enzyme inducers. Assess serum creatine, estimate creatine clearance, urine glucose, and urine protein.
Hi, my name is Natalie Nicole Dela Cruz, and I will be talking about combination drugs that are used to treat HIV and AIDS. Their brand names are as follow: Atripla, Tilura, Genvoya, and Stribild.
Atripla was approved for use by the FDA on July 12, 2006. It is composed of non-nucleoside reverse transcriptase inhibitors and nucleoside reverse transcriptase inhibitors. It contains 600 milligrams of efavirenz, 200 milligrams of emtricitabine, and 300 milligrams of tenofovir disoproxil fumarate, and it is to be taken at the same time once daily with food. Some common side effects of Atripla include headache, sleepiness, unsteadiness, and trouble sleeping. Adverse effects include lactic acidosis, psychiatric problems, and liver enlargement. Patients should not take this medication if they are pregnant. Monitor for signs and symptoms of lactic acidosis. Monitor labs for baseline and periodic renal function. Advise patient to avoid driving and other activities that require alertness while taking this drug. Tilura was approved by the FDA in March of 2018. This medication is a non-nucleoside reverse transcriptase inhibitor and active antiretroviral therapy drug. It contains 300 milligrams of efavirenz, 300 milligrams lamivudine, and 600 milligrams of tenofovir disoproxil fumarate, and it is to be taken at the same time once daily on an empty stomach. Some common side effects of Tulura include stuffy nose, muscle pain, heartburn, indigestion, and sore throat. Adverse effects include chills, diarrhea, headache, fatigue, depression, and lactic acidosis. Advise patient not to take this medication if pregnant. Monitor for signs and symptoms of lactic acidosis. Monitor labs for baseline and periodic renal function. Genvoya is a fixed-dose combination tablet containing 150 milligrams elvitegravir, 150 milligrams cobicistat, 200 milligrams emtricitabine, and 10 milligrams tenofovir alafenamide. Elvitegravir is an HIV-1 integrase strand transfer inhibitor. This medication was approved by the FDA in November of 2015. Some side effects include headache, abdominal pain, depression, diarrhea, rash, nausea, anxiety, insomnia, and dizziness. Adverse effects include weakness, unusual muscle pain, difficulty breathing, feeling cold in the extremities, lightheadedness, fast irregular heartbeat, and lactic acidosis. Do not take this medication if pregnant. Monitor for signs and symptoms of lactic acidosis. Monitor labs for baseline and periodic renal functions. Emtricitabine and tenofovir are primarily excreted by the kidneys. Co-administration of Genvoya with drugs that reduce renal function or compete for active tubular secretion may increase concentrations and effects of emtricitabine, tenofovir, and other renally eliminated drugs. Stribild was approved August 27, 2012, and is composed of 150 milligrams elvitegravir, 150 milligrams cobicistat, 200 milligrams emtricitabine, and 300 milligrams of tenofovir disoproxil fumarate. It contains an HIV-1 integrase strand inhibitor, pharmacokinetic enhancer, and a nucleotide analog reverse transcriptase inhibitor. Some side effects include diarrhea, gas, nausea, fatigue, drowsiness, dizziness, and headache. Some adverse effects include yellowing of the skin or eyes, also known as jaundice, insomnia, abnormal dreams, rash, and bone problems.
Hi, I'm Yunana Calderon, and now I'm going to discuss the continuation of the treatments of combination drugs, post-attachment inhibitors, and pharmacokinetic enhancers.
The first thing that I will discuss is the post-attachment inhibitors. Post-attachment inhibitors are a class of drugs that bind to the CD4 receptor on the host CD4 cell. This blocks HIV from attaching to the CCR5 and CXCR4 CAR receptors and entering the cell. Post-attachment inhibitors are part of a larger group of HIV drugs called entry inhibitors. Under the post-attachment inhibitors, we have the ibalizumab oik as the generic name and Trogarzo as the brand name. It is an IV medication and it was approved on June 20, 2003. The stock dosage is 200 milligrams per 1.33 ml. It is known to be received every 2 weeks. Known side effects are diarrhea, dizziness, nausea, and rashes. Some of the adverse reactions are unexplained weight loss, severe tiredness, muscle aches that doesn't go away, headaches that are severe or don't go away, joint pain, numbness, or tingling of the hands, feet, arms, or legs, vision changes, signs of infection, overactive thyroid, signs of Guillain-Barré syndrome or nerve problem, signs of liver disease, and iris. The nursing considerations of Trogarzo are as follows. It is not proven safe for pediatric patients. It is not advised to women doing breastfeed. Do not change the schedule of your ibalizumab oic infusions or any of your HIV medicines without talking to your healthcare provider first. Always take ibalizumab oic in combination with other HIV medicines. Next is the pharmacokinetic enhancers. Pharmacokinetic enhancer is also a drug classification that is used to boost the effectiveness of another drug. When the two drugs are given together, the pharmacokinetic enhancer interferes with the breakdown of the other drug, which allows the drug to remain in the body longer at a higher concentration. We have two medications under the pharmacokinetic enhancers class. First thing is the ritonavir as the generic name and Norvir as the brand name. It is an oral medication. It can be oral suspension or a tablet. It was approved on March 1, 1996. The stock dosage is 100 milligrams tablet, 80 milligrams per ml on oral solution, and 100 milligrams for oral powder. The recommended dose of Norvir film-coated tablets is 600 milligrams or 6 tablets twice daily by mouth. Gradually increasing the dose of ritonavir when initiating therapy may help to improve tolerance. Treatment should be initiated at 300 milligrams twice daily for a period of 3 days and increased by 100 milligrams twice daily increments up to 600 milligrams twice daily over a period of no longer than 14 days. Patients should not remain on 300 milligrams twice daily for more than 3 days. For children and adolescents, the recommended dosage of Norvir is 350 milligrams by mouth twice daily and should not exceed 600 milligrams twice daily. The side effects of ritonavir are dizziness and nausea. For the adverse reaction, you may have problems like pancreatitis, heart rhythm problems, severe allergic reactions, liver problems, and drug interactions. Some of the nursing considerations are always take ritonavir in combination with other HIV medicines and take ritonavir with meals. The second medication under the pharmacokinetic enhancer is tocilizumab as the generic name and Tybus as the brand name. It is an oral medication and it was approved on September 24, 2014. Its stock dosage is 150 milligrams and it is taken once daily. The side effects of tocilizumab is also the same with ritonavir. It is the dizziness and nausea. For the adverse reaction, you may have a kidney problem. For the nursing considerations, take tocilizumab once each day at the same time you take atazanavir or darunavir. Do not run out of tocilizumab. Take tocilizumab with food. When taken with atazanavir, common side effects are jaundice and rash. Next one is the fusion inhibitors. Fusion inhibitors is also known as entry inhibitors. These are a class of antiretroviral drugs used in combination therapy for the treatment of HIV infection. This class of drugs interferes with the binding, fusion, and entry of an HIV variant to a human cell. Under the fusion inhibitors, we have the enfuvirtide as the generic name and fusion as the brand name. It was approved on March 13, 2003, and it is only given as injection from injection kit, which contains 60 vials of enfuvirtide, each containing 100 milligrams of powder. It is injected under skin of outer thigh, upper arm, or stomach twice daily. The side effects are nausea, dizziness, injection site reactions, itching, swelling, redness, pain or discomfort, rash, bruising, hardened skin, and bumps. For the adverse effects, you may have experience rash, fever, chills, trouble breathing, hives, swelling of eyes, face, lips, nose or mouth, and low blood pressure. For the nursing considerations, assess patient for changes in severity of HIV symptoms and for symptoms of opportunistic infections throughout therapy. Assess patient for injection site reactions. Assess patient for signs and symptoms of pneumonia. Monitor patient for signs and symptoms of hypersensitivity reactions. Next is the CCR5 antagonist. CCR5 antagonist is a drug classification that blocks the CCR5 co-receptor on the surface of certain immune cells such as CD4 T lymphocytes or CD4 cells, and this prevents HIV from entering the cell. Under the CCR5 antagonist, we have Maraviroc as the generic name and Cellzentry as the brand name. It was approved on August 6, 2007, and its stock dosage is 20 milligrams per ml for oral solution, 25 milligrams, 75 milligrams, 150 milligrams, and 300 milligrams for tablets. For the side effects, you have stomach, pain, diarrhea, constipation, tiredness, lightheadedness or dizziness while standing, cold symptoms, insomnia, swelling, problems urinating, muscle or joint pain, skin rash. For the adverse reactions, you have rash or allergic reaction, jaundice, dark colored urine, vomiting, pain, aching, or tenderness on the right side of the stomach, fever, generally ill feeling, blisters or sores in the mouth, blisters or peeling of skin, swelling of face, mouth, and lips, and trouble breathing. For the nursing considerations, assess patient for changes in severity of HIV symptoms and for symptoms of opportunistic infections throughout therapy. Assess for signs and symptoms of hepatitis. Assess for rash periodically during therapy. May cause elevated AST, ALT, total bilirubin, amylase, and lipase, and may cause lowered absolute neutrophil count. Next one will be the integrase inhibitors. Integrase inhibitors are a class of antiretroviral drug designed to block the action of integrase, a viral enzyme that inserts the viral genome into the DNA of the host cell. We also have two medications under the integrase inhibitors. First one is the dolutegravir as the generic name and TVK as the brand name. It is also an oral medication and it was approved on August 13, 2013. Its stock dosage is 10 milligrams tabs, 25 milligrams tabs, 50 milligrams tabs, and always to be taken with other HIV medications. It is taken once a day. For the side effects, we have nausea, dizziness, changes in liver test results, changes in immune system, trouble sleeping, tiredness, and headache. For the adverse effects, we have rash or allergic reaction, jaundice, dark colored urine, vomiting, pain, aching, or tenderness on the right side of the stomach, fever, generally ill feeling, blisters or sores in the mouth, blisters or peeling of skin, swelling of face, mouth, and lips, and trouble breathing. For the nursing considerations, obtain negative pregnancy tests from patient before starting therapy. Monitor signs and symptoms of hypersensitivity reactions. The second medication under the integrase inhibitors is the raltegravir as the generic name and Isontress HD as the brand name. It is also an oral medication and it was approved on May 26, 2017. The stock dosage are 25 milligrams for 2 tabs, 100 milligrams for 2 tabs, 100 milligrams single-use packet for oral suspension, and we also have 400 milligrams or 600 milligrams for tabs. The side effects, adverse reactions, and nursing considerations for raltegravir is also the same with dolutegravir. This time, I will continue discussing 4 of the antiretroviral combination drugs, and these are Odef-C, Complera, Descovy, and Simduo. Odef-C is the combination of emtricitabine, rilpivirine, and tenofovir alafenamide drugs. It belongs to the 2 NRTIs and 1 NNRTI class. It was approved on March 1, 2016. Its stock dosage is 200 mg emtricitabine or Emtriva, 25 mg rilpivirine or Edurant, 25 mg tenofovir alafenamide. It is taken once a day with meal. Side effects of Odef-C are headache, dizziness, tiredness, depressed mood, insomnia, strange dreams, rash, nausea, diarrhea, changes in the shape or location of body fat, especially in your arms, legs, face, neck, breasts, and waist. For the adverse effect, we have the confusion, severe depression, unusual thoughts or behavior, suicidal thoughts or actions, increased thirst and urination, loss of appetite, weakness, constipation, kidney problems, liver problems, inflammation of the body, and severe allergic reactions. For the nursing considerations, do not take with any other HIV treatments. Second drug is the Complera. It is the combination of emtricitabine, rilpivirine, and tenofovir disoproxyl fumarate drugs. It is also an oral medication, and it belongs to 2 NRTIs and 1 NNRTI class. It was approved on August 10, 2011. Its stock dosage is 200 mg emtricitabine or Emtriva, 25 mg rilpivirine or Adjurant, and 300 mg tenofovir disoproxyl fumarate. It is taken once a day with meal as well. The side effects and adverse reactions for Complera is the same with Odef-C. For the nursing considerations, do not take with any other HIV treatments as well. Check if you have allergic reaction to this product. Before using this medication, tell your doctor or pharmacist your medical history. Rilpivirine may cause a condition that affects the heart rhythm. The third drug is Descovy. It is the combination of emtricitabine and tenofovir alafenamide drugs. It belongs to 2 NRTIs class and it was approved on April 4, 2016. The stock dosage is 200 mg for emtricitabine or Emtriva and 25 mg tenofovir alafenamide. It is taken once a day. Known side effects are nausea, changes in body fat distribution, changes in immune system, increased cholesterol, and upset stomach. For adverse reactions, kidney problem, severe acute exacerbation of hepatitis B, immune reconstitution syndrome or IRIS, bone problems such as bone pain, softening or thinning and fractures, and lactic acidosis. For the nursing considerations, do not take with any other HIV treatment. It is also not advised for lactating women. It is not indicated for use as pre-exposure prophylaxis to reduce the risk of acquiring HIV-1 infection. The fourth and last drug of combination drugs is the Simduo. It is the combination of lamivudine and tenofovir disoproxyl fumarate drugs. It belongs to 2 NRTIs class. It was approved on February 28, 2018. Its stock dosage is 300 mg lamivudine or Epivir and 300 mg tenofovir disoproxyl fumarate or Virid. It is taken once a day as well. For the side effects, we have depression, diarrhea, rash, back pain, fever, nausea, weakness, anxiety, vomiting, joint pain, insomnia, pneumonia, indigestion, muscle pain, dizziness, numbness, and tingling of extremities. For the adverse reaction, we have lactic acidosis or severe hepatomegaly with steatosis, exacerbations of hepatitis B, new onset or worsening renal impairment, hepatic decompensation in patients co-infected with HIV-1 and hepatitis C, pancreatitis, decreases in bone mineral density, and iris or fat redistribution. For the nursing considerations, do not take with any other HIV medicines as well. Take a missed dose as soon as possible unless it is closer to the time of your next dose. Do not double up on your next dose. The dosing frequency needs to be adjusted for people with decreased kidney function. Simduo and Temixi should not be used if CRCI is less than 50 ml per minute or if you are on dialysis. It must be taken in combination with another antiretroviral which does not contain the medications in this drug from the same drug class.